What are 5 trends in psychology? Emerald Psychiatry and TMS Center have located 5 major mental health trends that are occurring in 2019. The American Psychological Association, APA, recently released a list of the top 5 trends in psychology. Here is a summary of their top 5 psychology-related trends. Impact of climate change. The growth of drug-free pain management. A demand for more sports psychologists understanding how nutrition impacts mental health, helping to redesign the concept of long-term care. The numerous and unprecedented impact of climate change is number 1 on the American Psychological Association list of trends. People are going to have to learn to live in a warmer world with different weather patterns. Organizations and policymakers are recognizing the vital role that psychology can play in finding solutions to mitigate global warming and help people adapt to the changes that are to come. In the past, psychologists and other mental health professionals have worked in order to motivate people to change their behavior. This included things like making choices that protect the environment. However, climate change is a human problem that will force people to learn to adapt. Research has shown that suicide rates increase during months that have high temperatures. There are concerns that higher temperatures due to climate change will increase the number of deaths by suicide in North America by 2050. Especially in the regions of the United States and Mexico. But skilled mental health providers should be able to alleviate this trend. Mitigating the effects of climate change on people will take input from many medical health specialties, but including mental health is a step in the right direction. The opioid crisis has altered how the American health system responds to chronic pain. It is now well known that people with chronic pain can gradually become addicted to opioids. Roughly 100 million Americans have some form of chronic pain. This is more than diabetes, heart disease and cancer combined. Now, there is more of an emphasis on treating patients with chronic pain by using non-pharmacological methods. Some of these non-drug methods include the use of psychological treatments.
For example, federal agencies are conducting pain management research for military and veteran personnel who suffer from chronic pain. A joint U.S. Department of Health and Human Services, HHS, the Department of Defense, DoD, and the Department of Veterans Affairs, VA, awarded multiple grants totaling $81 million in order to find helpful non-drug approaches. The goal is to use treatment approaches from pain psychology in order to provide alternative treatments for pain that work just as well as traditional primary treatments for pain.
Societal misunderstandings and other stigma keep athletes from seeking help for mental health concerns. However, as athletes increasingly seek help from sports psychologists, they are finding overall increased success on the playing field. This, in turn, sends a powerful message to the rest of society that it is okay to seek help. In fact, it is actually beneficial in the long term. The modern U.S. workforce has a number of occupations that are stressful and require people to operate in a high-stakes environment. This has inspired the traditional field of sports psychologists to expand the range of people they treat. Sports psychology is no longer just for athletes. Stage, movie performers, CEOs for Fortune 500 companies and surgeons are some occupations that carry a considerable amount of stress. These jobs also require top performance with little margin for error. All of these previously mentioned occupations require individuals to not be hampered by anxiety and display levels of top performance. Almost everyone, from the athletic field to the boardroom, wants to improve their cognitive abilities and gain a mental edge over their competition.
There is a growing understanding among behavioral and mental health professionals that people's dietary choices impact their mental health. This has motivated psychiatrists and psychologists to look at nutrition as a valuable tool to improve a person's physical and mental health. Studies have shown that factors like biology, nutrition, child involvement and mealtime rituals all interact together to predict dietary behavior. Healthcare providers realize that not all food is created equal. Researchers believe that digestive issues appear to coincide with feelings of low energy and a negative mood. Due to the demands of new demographic trends, the American health system is re-examining how it looks at long-term care. Much of this redesign is due to the population growth of senior citizens as well as the push to control healthcare expenses. Psychologists are playing an important role in creating and guiding new patient-centered care models that seek to better serve residents and staff in long-term care. Recent federal regulations require a greater focus on the mental health needs of long-term care residents. Due to demand for the treatment and advocacy from groups like the APA, Medicare Part B mental health copayment was reduced from 50% in 2008 to 20% in 2014.